Last year, Neville gave 2 talks to the Royal College of Psychiatrists conference on the Gold Coast on the topic of working with patients with psychosis. Following these talks, a group of interested psychotherapists was formed in Sydney, and we felt that there might be sufficient interest in Sydney for Neville to give these talks again here for those of us who missed them. Since he came to Sydney in 1986, Neville's been an active and very generous contributor to the life of psychoanalysis in this country, both as clinician and as supervisor, and he's held positions as chairman of the Sydney Institute for Psychoanalysis and president of the Australian Psychoanalytical Society. During these years, he's also produced a significant body of published work. He brings to his writing and teaching the breadth of his studies and interest in psychology, theology, philosophy, literature, science, and the humanities. Speaking personally, his work first came to my notice when I was a young general psychiatrist inclining towards psychotherapy. I came across his book, The Analytic Experience, a collection of his lectures given at the Tavistock. His writing immediately caught my attention and imagination, and has become and continued to be a resource for me. I found the way he wrote both accessible and humane. I also enjoyed his sense of humour and his delightful sense of self-deprecation. Here was someone writing about what could be thought of as an intangible topic, that is to say, about the relationship with the patient, but validating it as lying at the very heart of the work. His writing inspired confidence that one could find a more direct way of conversing with patients without assuming an authoritarian role when one was actually pretty much in the dark about what was being communicated. I think his qualities as a seeker of understanding have probably led him naturally to an attempt to understand those misunderstood of patients exhibiting psychotic phenomena, to try to help to make sense of what can so easily sound like nonsense, and to try to manage the uncomfortable feelings that this induces in us as therapists, so that we may better help our patients in their attempt to get hold of at least parts of their own minds. I remember my very first allocated psychotherapy patient was in Aberdeen. She was a young woman on the ward I was working in with severe bipolar disorder. She was intermittently, floridly psychotic. I had no idea what I was being asked to undertake. And of course today in my comfortable private practice I'd run a mile from trying to engage with anybody with such a condition. And yet looking back, I had excellent and steadfast supervision from a staff psychoanalyst, and we struggled along for many months. I still have a painting that she gave me when I was posted to my next hospital, and the note that she gave me to the effect that it wasn't the solution to her problems that had mattered to her so much as our attempt to struggle with them together. It seemed to have made a difference for her. Judging by your presence here, there are others interested in thinking about the importance and challenge of working with patients who have psychotic phenomena, and I'm very pleased to hand over to Neville now for him to share his thoughts